Why am I starting an advocacy group for the mentally ill, the elderly, and the community associations? Although we are organizing this in Florida, we hope that, in the long run, others will carry our torch in other states. When serving as the treasurer for my condominium association, I halted the foreclosure of a destitute owner with advanced dementia who had no family and whose only asset was his condominium. What would have happened had the foreclosure continued? Since the local police supervise evictions, they would likely have referred him to the proper agencies so he could be placed in a facility. Or maybe not. Even though Florida law encourages police officers to become aware of dementia-related issues, this is a learning process, and it will take time for this to become second nature with many. Now, what would happen if a demented resident is turned out on the street by an eviction? If a lost and wandering dementia patient is not found within 2 days, experts say that there's a 1 in 4 chance he will be found face down, drowned in a ditch or a canal. But if someone is not looking out for a demented patient, the odds are far worse. This sparked a condominium war, in which only a few owners supported my efforts to slow down the proceedings to have a court appoint a guardian who could place him in an appropriate lockdown facility, sell his unit, and pay his overdue condominium maintenance fees. His demented behavior turned most of his neighbors, and perhaps his estranged sister, against him. Today, our condominium association is forming a committee to determine how to help our neighbors who suffer from dementia and mental health issues. What can we do to resolve this? Many property managers and condo board members blindly follow the no pay, no stay rule, saying they don't want to run a nursing home. So how can we change this dynamic? We plan to lobby the Florida legislature to require condominium property managers and board members to learn the basics of when they should suspect mental health conditions, and most importantly, who to call for diagnosis and assistance. And this would be part of their professional exams and education. Now, this is a realistic goal, I do believe, as our story is quite compelling. Now, we're asking for support to achieve these objectives by reimbursing our lobbying and education expenses. And we will cooperate rather than compete with the various nonprofit and trade associations, including CAI, Community Associations Institute, the Alzheimer's Association, and other public interest advocacy groups. And we will seek to raise awareness with the various Rotary clubs and other nonprofit organizations, in particular the Kiwanis and Lions clubs. These 3 named organizations were formed in the early 20th century, and they are each primarily service organizations, founding their ethos on the Golden Rule: to love and seek the good, and love your neighbor as yourself. Our ethos extends this: love your neighbor as yourself, even when they're demented, autistic, or just plain ornery and difficult. Now, in 2017, Steve Leifman, an associate administrative judge for the 11th Judicial Circuit in Miami-Dade County, was the author of an article in the Atlantic magazine, How Mental Health Training for Police Can Save Lives and Taxpayer Dollars. Currently, the continuing CIT training in Florida for policemen is optional. We will also promote best practices for community associations, including the calculation of full reserves for CSRS assets. The Florida statutes require that the reserve funds for CSRS assets for larger condominium associations be fully funded, but does not precisely define what that means. By default, this means that the reserve reporting firm determines when the reserves will be fully funded. The national industry standard is up to 30 years, which is clearly not best practice for CSRS assets. We propose that an alternative funding plan for reserves for CSRS assets contain a safe harbor, so that if the reserve plan is fully funded within 10 years, within the CSRS reserves will be deemed to be fully funded, subject to DBPR oversight. We share this idea of incorporating a safe harbor method into the alternative funding method, as I discussed in our editorial. Many legislators thought that this was an excellent idea. They stated that if we initiated our lobbying effort earlier, we would have had better success at persuading the legislature to enact it into law. So if we lobby for this in the summer, after the special sessions end, we'll have an excellent chance of gaining traction. And we plan to advocate before the Community Association Institute, both locally and nationally, as well as support many of their Florida lobbying efforts. And we're a member of the local chapter and hope to publish articles in their local and national magazines, as well as the Florida Community Association magazine. Each regional chapter has their own set of web pages as well, and Florida has several chapters. We plan to advocate to the Alzheimer's Association, both locally and nationally, as well as support their Florida lobbying efforts. And we're a volunteer for their walk and organize several Rotary and church teams. And the Alzheimer's Association is a totally free 24/7 hotline manned by professionals, as caretakers may require assistance any day, any time. Now, many mental health nonprofit organizations sponsor walks in Broward and Miami-Dade counties in Florida, and in many cities and counties across the United States and other countries, which are great projects for Rotary clubs and other organizations. You simply form a team and show up for the Saturday morning event. Since the National Rotary Organization donates to the Alzheimer's Association, local Rotary clubs are provided with a tent with further fundraising requirements. Many of the other walks will also provide a tent for Rotary clubs. And most of these walks are in the fourth quarter of the year in South Florida. And we will support the efforts of the Autism Hero Project nonprofit organization that has been active in Illinois and has recently opened a Florida branch. They champion increased training for police departments as well as a blue envelope program. Young autistic drivers would be issued a blue envelope that describes their condition, so any police officer pulling them over can understand that they do not respond well to flashing lights and brusque commands. And we support the efforts of the Rotary mental health action groups to improve the care given to children and adolescents suffering from mental health challenges. And we have a reflection on how church groups, small cities, Rotary clubs, and other organizations can sponsor their own health and wellness seminars that include discussions on mental health and dementia. And we've published several dozen reflections on mental health and aging topics that we will publish through the Advocate's website. And some of these will be the basis of articles submitted to local and national media. Now we will review various reflections on dementia, aging, and mental health which we plan to reference in our upcoming website. If you're curious about neurological diseases and conditions, you'll find the story of Phineas Gage fascinating. Every series of introductory psychology lectures tells his story. Every medical student will likely read the equally fascinating collection of neurological case studies in The Man Who Mistook His Wife for a Hat, and when the fourth wife of Glenn Campbell described their life from the decade before his dementia diagnosis, and then his diagnosis and how his dementia evolved until his passing, she gifted us probably the most complete case study of someone suffering from Alzheimer's. The daughter of Rita Hayworth was one of the original fundraisers for the fledgling Alzheimer's Association, as her mother was one of the first celebrities to admit their diagnosis. Tony Bennett also suffered from dementia. The story of Glenn Campbell's and Tony Bennett's final concerts are touching. In the book, Travelers to Unimaginable Lands contains case studies of caretakers of those who suffer from dementia and other neurological disorders, which would be a great encouragement for those facing the challenges of living with these disorders. We have about a dozen reflections on aging, retirement, and suicide by ancient Stoic philosophers, church fathers, the Christian psychologist Paul Tournier, Jimmy Carter, and others. The ancient Greeks and Romans were more tolerant of suicides than we are today, possibly in part because their doctors did not have the access to the pain medications we have today. The Stoic Epictetus was generally opposed to suicide, while St. Augustine was opposed to suicide under all circumstances. And Seneca was obsessed with suicide, since he knew that one day Nero's soldiers would come one day, giving him the choice of dying by his sword or by theirs. And the opening chapter of Plato's Republic discusses aging. Now, Sunrise Chief Police Daniel Ransone spoke on policing and mental health. And recently, the Alzheimer's Association proposed legislation requiring that optional mental health training be included in the CIT police training courses, which the Florida legislature passed. Now, how do you prioritize law and order with the need to safeguard the mental health of those whom officers encounter every day on their beat? The Sunrise Police Department has recently hired several social workers for their staff. And these reflections refer to a Sunrise Community Police Academy course I recently participated in. This course includes many of the same topics and simulations from the local police academy. We had David Sanderson of the Weston Rotary Club speak on how his brother developed Parkinson's disease, plus his work for the Parkinson's Foundation. We also reviewed Michael J. Fox's books on his experience living and coping with Parkinson's disease. Plus, we get a glimpse into how movie stars' lives differ from our own. We reflected on the history of Rotary International. Rotary was founded over a century ago as a service organization and provided input in establishing the United States relief organizations after World War II. Rotary supports nonprofits and educational endeavors locally, nationally, and internationally, I also discuss why I joined Rotary and some of the benefits of joining Rotary. Another reflection includes a compendium of reflections on morality, philosophy, and history, and roughly their order of views. We can also speak on these topics, for local community groups. We have a list of some of the additional topics we plan to explore. We're not going to read them off at this time. And I also have a page here describing my journalism experience that you can see in my LinkedIn profile.